Hello and welcome to the Stroke Matters podcast. This series is brought to you by the Stroke Link Nurse Service in the Mater Hospital. On this podcast, we will discuss all things stroke.
With expert advice from stroke healthcare professionals and stroke community support services, along with hearing inspirational stories from stroke survivors, we will bring you all you need to know to help support you on your journey to living well after a stroke.
This podcast is recorded in the Mater Hospital and is for educational and entertainment purposes only, and does not contain personalised medical content or advice.
You can check out our website on www.strokelink.ie, and please feel free to share it with family and friends.
So today for our first podcast, we are joined by Dr. Michael Marnane. Dr. Marnane is a consultant neurologist at the Mater Misericordiae University Hospital and the Dublin Neurological Institute. He is Associate Clinical Professor of Neurology at University College Dublin. We have been extremely fortunate to work so closely with Dr. Marnane as the medical lead for Stroke Link service in the Mater. Dr. Marnane, you are very welcome today and many thanks for joining us.
Thanks very much for the kind introduction and for inviting me for your very first podcast.
Yeah, it's great to have you.
So I suppose, Michael, many people know the word stroke, but many might not know what that word means and that there are different types of stroke. Could you perhaps tell us what a stroke is and maybe explain the different types of strokes and how prevalent strokes are?
I should start by saying why it's important for the listeners to know about stroke, and the reason is because it's very, very common. So unfortunately, 1 in 4 of us at some time in our life will have personal experience of a stroke. So 1 in 4 people in the world will have a stroke in their lifetime, and nearly all of us will know somebody who's had a stroke, or maybe even care for someone who's had a stroke. Globally, it's the second leading cause of death and the leading cause of acquired long-term disability. And there's about 12 million people around the world that suffer a stroke every year. Unfortunately, women have more strokes than men and are more likely to die from their strokes. And the rates are increasing. And as the population ages, every year there's more strokes, more new strokes, more people living with strokes in the community as the treatments improve. And in about 10 years' time, the tsunami is coming. The number of strokes will have increased. It's estimated by about 60%. So if you don't know about stroke, now's your chance. Keep listening. Hopefully we can fill in some of the blanks. So I suppose your question was, what is a stroke? And I maybe start by saying a stroke is a medical emergency. It happens when blood supply to part of the brain is interrupted. And this can be due to a clot blocking a blood vessel or when there's leakage from a burst blood vessel. And ultimately that leads to a reduction in the supply of oxygen and nutrients to the brain, causing sudden nerve cell malfunction and potentially permanent brain damage if some of these emergency treatments are not instigated. And I use the word emergency because everything's happening very, very quickly. So when those blood vessels are blocked, the neurons are dying at a rate of up to 2 million per minute. So any delay really does count. So if you think you're having a stroke, or if you feel a loved one is having a stroke, it's important to seek help immediately. And that's by calling an ambulance without delay. So the types of things you might look out for if you think you're having a stroke are sudden neurological symptoms. And one handy way of remembering some of the common symptoms of stroke is using the mnemonic BFAST. So B is for balance. So if you have a sudden balance problem. E is for eye problems, so sudden loss of vision or double vision. F is for facial. That might be drooping in the face or asymmetry of the face. A is for arm, which is weakness or numbness of your arm or your leg. S is for speech, meaning difficulty getting the words out or thinking of the words. And T is for time, meaning this is urgent, call 999 or 112 for an ambulance. I think the other thing you asked was just about what types of strokes there are. So The commonest type of stroke is ischemic stroke. So that's the type where the blood vessel gets blocked with a clot. That accounts for about 85%. And those clots can come from a variety of places. And one of the common places is the heart. So if you have an irregular rhythm in your heart, or the pump function, the muscle of your heart is not as strong as it should be, clots can form because the blood isn't circulating as readily as it should be. And those clots can break off and pass up into the blood vessels in the brain. Clots can also form on the arteries or blood vessels themselves. That can be the blood vessels in your neck or in your head. And that can be due to damage from high blood pressure or from fatty deposits accumulating in the blood vessels, damaging them, something called atherosclerosis.
Okay.
Hemorrhagic stroke is less common than ischemic stroke, accounting for about 15%, and that happens when a blood vessel bursts inside the skull or around the brain. And that's most commonly caused by damage to small blood vessels due to chronically high blood pressure or a condition of aging, a kind of a cousin of Alzheimer's disease called cerebral amyloid angiopathy, where the amyloid protein that is associated with Alzheimer's disease, instead of building up in the brain, it builds up in the blood vessels, damaging the little blood vessels and leading to bleeds in the brain. Hemorrhagic stroke can also be caused by other abnormalities of blood vessels, such as aneurysms, which are bulges in the arteries and larger arteries, or vascular malformations. And I think you asked what sort of things can lead to increased risk for stroke. So I mentioned some of them already: high blood pressure, diabetes, high cholesterol, obesity, obstructive sleep apnea, which is difficulty with the breathing stopping at night time, coronary artery disease, and I mentioned already the irregular rhythms in the heart, such as atrial fibrillation, are some of the common causes. And of course, smoking, drinking, using illicit drugs can also increase your stroke risk.
Okay, thank you.
Dr. Marnane, just to touch on a few things you just mentioned there, one of the most important is the Be Fast campaign. And that's something that many people probably aren't aware of. A lot of people think the FAST campaign, they kind of go with the symptoms from the FAST campaign, face, arms, speech. That's great that you're able to share that information, that issues with balance and issues with eyes are also something that shouldn't be ignored, and we should be acting quickly on them and calling an ambulance. Just touching on a few other things as well. You were saying that, strokes are happening more often now, we're living longer, they're increasing, but as that's happening, there's also better treatments that are being developed. One thing that we see quite often in our job is that many people associate stroke with severe disabilities, whether it's neurological disabilities or physical disabilities, when in fact there is a huge number of people who have a stroke, are returning home, are returning to live a healthy life, are returning back to work, back to the normal activities. Just what are your thoughts on that misconception?
I think it's a really important point. So the numbers from Ireland are available, and approximately 56% of people will have a full or almost full recovery from their stroke. So more than half of people are making a full recovery. Unfortunately, about a third will be left with moderate or severe disability, but many of those people are living a happy and healthy life after their stroke. And unfortunately, about 8% of people will die. The good news is the Irish National Stroke Audit also shows that we're getting better in terms of how we're helping people who have had a stroke, with the mortality rate falling by about 30% from 2013 to 2021. And these improvements are likely due to better access to stroke specialist care across the country, with dedicated stroke teams and stroke units, and these advanced treatments, clot-busting medications, thrombectomy procedures for clot retrieval. I guess more in a personal perspective, I have the privilege of kind of starting at the very beginning. Often in the middle of the night, you get the phone call that someone's having a stroke, or I get called down to the emergency department. And, that's often very stressful, both for the patients and all the staff, because we're trying to make everything happen as quickly as possible to try and get these life-saving and brain-saving treatments applied as quickly as possible. And then I see the next phase where the next day you come into the patient, they're starting to comprehend what's happened. They're starting to have people come and visit them or get pulled down for tests. So there's a lot going on. They're juggling a lot of balls at that time. And then over the next few days, it really starts to sink in, and sometimes the mood can be affected. And then you see the next phase where maybe people are starting to talk about home or talk about a rehab unit. And then I also have the privilege of seeing these people 3 or 6 months down the road, and they're there in their normal clothes, often very fashionable, and you don't recognise them. And you don't recognise them, one, because of the very nice clothes, but also because they're different people. They have their confidence back. They've made amazing recoveries, and also not just recovery from whatever stroke problems they have, but also in the way that they live their life. So a lot of them, this is the kind of the warning they maybe needed, that life was going the wrong way. And some of them, as we mentioned, more than half of them have had a very minor episode, but they've taken that opportunity, that warning that things were going the wrong way, they were on the wrong path, and really made changes like stopping smoking, monitoring their blood pressure, getting cholesterol checked regularly with the GP, having a healthy diet such as the Mediterranean diet. All these things are possible in people who maybe have lived their life one way, but suddenly when they get this wake-up call, they grasp it with both hands and live differently. So I'm very positive because I get to see the full journey, and it's really amazing to see what outcomes are possible. I'm always reminded of one particular patient who had the worst type of stroke. It was a stroke in a major artery called the middle cerebral artery that supplies almost 2/3 of one side of your brain. And she had such severe swelling in her brain that she had to have half her skull taken off. Really, really severe stroke, probably with a mortality rate of more than half. And that same patient walks into my clinic. She uses a stick, but she walks into my clinic and really tells me what she wants and what she's going to do next and what her plans for her holidays are. And that really inspired me that even in the most severe types of stroke, you should never give up, because people can really get back to a very high quality of life, even with the most severe strokes.
With stroke recovery at home and seeing those patients that are coming back in, they've made an awful lot of healthy lifestyle changes, but what factors do you think most influence a good stroke recovery at home for those patients?
I think, if you're fortunate enough to make it to the right place and have the right team around you, I think that's a good predictor. So we have a growing number of stroke specialist beds around the country and growing stroke specialist teams around the country. And I think that's very important to have those experts in lots of different areas that can give you the right information at the right time in the right way. But it's not just that. It's also having other support networks, having the family, having carers that can help you when you're having those down moments, that can keep you on the right track, that can help you to get to the appointment when you don't feel like going, when the energy levels are low. I think the emergency treatments are very important. And again, geography plays a little bit in that, but the systems have been set up that really anywhere in the country, a phone call can be made and you can end up in a centre where you can get the clot-busting medication, where you could be transferred to these thrombectomy centres in Beaumont or in Cork, or in Belfast to have clot removal therapies. I think it can't be overestimated the importance of that engagement piece. And I think it's normal and natural for your confidence and your mood to take a hit sometimes when something like this comes so out of the blue and maybe unexpected, maybe unwarranted. But at the same time, the people that can kind of keep the glass half full often do better. And I think we as medical professionals have a role in making sure that the mood is dealt with, that the energy levels are dealt with and supported, so people can engage fully and get the most out of their recovery.
Absolutely agreed. Like a lot of our patients, like you're saying, it happens out of the blue, it is unexpected, and all of a sudden it's a massive life-changing event. And like you're saying, it's just really important to make sure that they do seek the help from their family, their friends, or if they are having down days, to make sure that link in with the GP.
Yeah,
all these things will help support
there are lots of
recovery at
supports
home.
and services out there for people, absolutely, and for, I suppose, family members and carers of people who've had strokes as well.
Minding their own health and knowing what they need to be doing and looking into local services that are in their community that are available to support them if needed.
Mm-hmm. Michael, you touched there a little bit on some of the new therapies and treatments that are available for people who've had strokes. Would you mind telling us a little bit about those?
Yeah, the clot-busting medications have been with us, certainly in the Mater Hospital, since about 2008. And I think I mentioned in your introductory question about sort of seeing patients and the benefit. I still remember a very lovely local gentleman from Cabra, which is just up the road from here, who had a very severe stroke and was the first patient I was involved with in terms of giving clot-busting medication. And just to see that person go from almost certainly ending up in a wheelchair, maybe ending up in a nursing home, definitely not being able to converse with the grandkids, to really walking out of the hospital 2 or 3 days later, cracking jokes and very grateful for the experience that he's had. I think he even ended up in RTE.
Oh, wow.
Because they were interested in this new exciting treatment back at that stage. And that story has kind of continued. So we've gone from clot-busting medications to interventional treatments. So these are treatments where they can put devices into the blood vessels, either in the groin or in the arm, and then using wires, bring the device up to where the clot is and grab it with a basket and pull the clot out. And again, the results internationally, both in terms of patient outcomes and the outcomes of human beings, but also in terms of economics, the numbers are very stark in terms of how effective these treatments are.
Yeah, there certainly have been some amazing advances. And I think, as you said earlier on, timing for some of these treatments or therapies is very important as well.
Yes. Yeah.
acting quickly and getting to the hospital as fast as possible.
Yeah, I'd probably reiterate that. I know I mentioned the 2 million neurons every minute, but really every minute counts, and the quicker you get in, the more effective these treatments are. You know, really every minute counts, as I mentioned. And I probably should also just bring attention to the fact that being in a stroke unit, so being in a place in the hospital where the specialists are physiotherapists, occupational therapists, psychologists, medical social worker, specialist nurses, ward nurses, doctors, etc., are all in one place. That also has a very substantial and well-studied effect on patient outcomes. And, you know, it's very exciting and reassuring that the numbers of those stroke beds are increasing across the country. It would be nice to see it happen quicker and more extensively, but it's certainly improving things. And we can see that in the numbers as well. Certainly the mortality rates have gone down substantially.
Yeah, we're getting there for sure. Yeah. So, Michael, stroke is something that can occur at any age, and we certainly, see patients of all ages here in the Mater every day who've had strokes. We do see an awful lot of stroke in younger people. Perhaps that's something that many people aren't as aware of, is that stroke can happen with younger people, and it is quite common. Can you tell us a little bit about, your experience of looking after young people with stroke?
Yeah, so maybe I'll start with a couple of statistics. So age is definitely a risk factor for stroke, and your stroke risk doubles each decade after age 55. Having said that, more than half of all strokes happen in people under the age of 70. And in Ireland, 1 in 4 strokes are now occurring in people of working age. And in contrast to the overall trend that I mentioned earlier, it's more common, young stroke is more common in men than in women. And the rates of stroke, while the prevalence, meaning the overall number of strokes around the world, is increasing, the incidence, meaning the number of new strokes in general, is decreasing, and that's probably because of better treatment of vascular risk factors, etc. However, in young patients around the world between 25 and 44, the rates are increasing.
Yeah.
And while it needs more study, it looks like things like diet are big contributors, and that's high salt diet, high calorie diets leading to obesity, hypertension, high cholesterol levels. That seems to be driving a lot of that increase.
Yeah.
In terms of what sort of risk factors might be important in preventing stroke, I think it's important maybe to comment on that both in terms of younger patients but also older patients. So the World Health Organization say that up to 80% of strokes are preventable through lifestyle changes and medical management. So that's, if you want to put me and my colleagues out of a job, all of us here out of a job, you'll listen to the next bit of this here. And if you just had to pick, we're not suggesting you just pick one thing, but if you just had to pick one thing to target around the world, that would be high blood pressure. So if we manage to control everyone's blood pressure around the world, there'd be half as many strokes. So the interstroke study published in the Lancet in 2010 showed that I'm going to use a big word here, population attributable risk for high blood pressure is about 47.9%. So that means that if we effectively control blood pressure, nearly half of all strokes would be prevented. And that's not an easy task, but it's certainly something that we can do. And every reduction is a reduction in stroke risk. Every reduction in blood pressure is a reduction in stroke risk as well. In terms of other kind of ways that you can prevent stroke, maintaining a healthy weight is certainly important, and having a healthy diet. And we often recommend diets such as the Mediterranean diet to our patients. Having exercise is a regular part of your daily routine, avoiding smoking, avoiding alcohol excess, not using illicit drugs. We often see young patients who maybe rarely use illicit drugs, and maybe they took some cocaine or they smoked a joint, and that can just be the one trigger that lands them in the emergency department with a stroke at a young age. I would say it's important to be health literate, and if you don't know what your blood pressure is, you probably should know what it is. Yeah. You can buy blood pressure monitors very cheaply, maybe €50. You can get a very fancy one for just over €100, which you can connect to your smartphone and will give you all your averages and statistics, and you can show it to your GP or your stroke doctor if you're plugged into the stroke services. You should also probably know your cholesterol, so it's very easy to book an appointment with your GP. You might wait a little bit because they're very busy, but you can get your cholesterol checked, and it might be that it changes in your diet can bring that cholesterol down, or it might be that medications are needed. And many people have diabetes and don't know, or are pre-diabetes and don't know they have it. So again, that's a very simple blood test that you can get done with your GP. It's probably also useful to know about some related conditions. So coronary artery disease or blockages in the arteries in the heart. We'll all be familiar with the chest pain that can happen when you're having an acute heart attack, but some people can just get breathless, have pain in their arm, pain in their jaw, and that often happens when they're exerting themselves. Another important condition when it comes to stroke risk is something called obstructive sleep apnea. I mentioned it briefly later on, but if you or your partner are heavy snorers, or you hear your partner stopping breathing in their sleep, or your loved one stopping breathing in their sleep, or if you or they are very sleepy in the daytime, it could be that they have obstructive sleep apnea, which is a condition that can drive up blood pressure at night time. It can also predispose to irregular rhythm in the heart, such as atrial fibrillation, all of which can increase your stroke risk.
Okay.
And that's a good segue potentially to atrial fibrillation, which is a type of irregular heartbeat that, as I mentioned before, can cause clots to form in the heart, and those clots can break off and cause strokes. And the symptoms of atrial fibrillation are things like chest palpitations, feeling a rapid or irregular pulse, feeling breathless, having chest pain. Again, should hopefully prompt you to see your GP. And maybe a plug to anyone who's listening who is making decisions about spending money on all these things. So it's estimated that every €1 spent on preventing, in addressing some of these preventable conditions like high blood pressure, high cholesterol, gives a 10-year return, because dealing with stroke is very expensive.
Yeah, absolutely. Just what you were saying there about the blood pressure being so important, that everyone should know what their blood pressure is, especially if you've had a stroke. But yeah, we would always recommend keeping an eye on your blood pressure, but not just for people who've had a stroke to try prevent another stroke, but it's also very important for anyone of any age to check their blood pressure every now and then. And whether if they can't get their hands on a machine, just to know that they can always attend their local chemist. A lot of chemists and pharmacies do blood pressure checks. It's good to have that resource there if you want to keep an eye on your blood pressure. And just as well about the cholesterol, you were mentioning that it's extremely important to monitor your cholesterol, keep your cholesterol within a healthy range. A lot of people might know the connection between high cholesterol and stroke. Could you maybe just give us a little bit information on that?
A lot of these things can kind of come together and ultimately damage the blood vessels. And when you look at surgical samples, so there's an operation called a carotid endarterectomy. That's where the surgeons open one of the big blood vessels called carotid artery in the neck and remove some of these cholesterol plaques. And when you look at them under a microscope, you see this mess of cholesterol crystals, calcium crystals, lots of inflammatory cells, very angry looking blood vessels that aren't happy. And ultimately with all that inflammation, the fibrous tissue that overlies the cholesterol bursts, and once it bursts, the blood clots on top of it, and that's how strokes happen. It's also exactly how heart attacks happen when those cholesterol plaques become unstable and burst and block the blood vessels in the heart.
Okay.
That's all been absolutely amazing information, Dr. Marnane. Thank you so much. Just last question, I guess. What advice would you give to a survivor or a family member who is supporting someone who has had a stroke?
Supporting someone after a stroke can be challenging both emotionally and physically, but it's also an opportunity to play a vital role in someone's recovery and building their future life. If I could give family members or carers a little bit of advice, I think the first thing I would say is be patient and be positive. The recovery takes time. It often happens in small steps, but they're imperceptible but very progressive steps.
Yeah.
Celebrate the little wins, and there will be lots of little wins along the way. And know that there will be emotional and energy ups and downs, and that's normal for both yourself and the survivor from the stroke. I would say knowledge is power. And while there's a lot going on in the first hours and days, certainly in the Mater, and I know in many other hospitals across the country, you'll be going home with some information, some websites, some contacts. Take advantage of those things. Learn about the physical effects, learn about the cognitive effects, learn about the emotional impacts of stroke and how best to deal with them. Because there's better ways and worse ways of dealing with these things.
Yeah.
Use all the chances that you have to learn more. So attend all your hospital appointments. Go for the tests that are recommended by your healthcare professionals. Attend the rehabilitation sessions if you can go with your partner or your loved one, and ask questions. So ask the doctors, ask the nurses, ask the therapists questions.
Extremely important, yeah.
And then don't forget that there's a person behind the stroke. So support their independence, encourage them to take tasks on themselves where it's possible without stressing them out, without having falls. Try and avoid doing everything for them. There's always that inclination, especially when things are slow. But function is therapy too. And the more they can do, the more they will be able to do. And then, of course, make the home safe and accessible. And often our community teams, early support discharge teams, will have thought of things that might increase falls risk, adding in grab rails to make mobility better, and adding any equipment, etc. For patients who can't speak very well, so whether that be dysphasia, which is difficulty with language, or dysarthria, which is difficulty with the generation of speech, be a communication ally, not a replacement. So try and let them speak, and try and empower them to communicate. And speech and language therapists will be able to help with things like pictures or gestures or writing, whatever is appropriate in the particular situation you and your loved one find themselves in. And then maybe most importantly, manage your own well-being. So the team has to stay strong, and sometimes you do need to take time out and you do need to get support. So don't try and do everything yourself. Seek emotional support, seek physical support, accept help. There's more than you know out there, and hopefully if the stroke teams that you come in contact with, the community teams that you come in contact with, will be able to point you in the direction of the local resources. But nationally, there's things like the Irish Heart Foundation have very, very good and well-developed support, both peer support and professional support resources. CRE in the west of Ireland has a similar support facilities. Acquired Brain Injury Ireland and Headways also have very good supports and education. But make use of your local teams. The public health nurse, develop a relationship with your GP, visit them regularly, join the chronic disease management program with your GP, and look after yourself. Maybe look into getting a counsellor, someone that you can talk to that isn't the person that's affected. And then in terms of the stroke survivor themselves, I always try to say to people that day one is the worst day. Assuming that there isn't any bumps in the road, and there always is bumps in the road, with a stroke, when a blood vessel blocks or bursts, day one or the first couple of days is usually the worst moment. And then the recovery starts, and every day from that, things are getting better. It may not feel like it, but they are getting better. And when they look at themselves in 3 months' time, in 6 months' time, in 12 months' time, they're not going to recognize that person because it's going to be a very different person. And how they are now, today is not how they're going to be in 3, 6, 12 months' time. And I think it's really important to keep their eye on the prize in that regard. Yeah. And that's important because when the physiotherapist and the occupational therapist and the speech therapist comes around looking for them to go down to the gym or have some invasive procedure to check their swallow, they're not going to feel like engaging with that because they're going to be tired, maybe going to be sore, uncomfortable. But a lot of the healing happens in those first few days and weeks. And if they can keep their eye on the future goal of independence and getting back to a enjoyable, happy, healthy life, those inconveniences, those things that they feel like they don't want to do, become super important to engage with.
Yeah, absolutely.
And there's actually a biological basis for that in terms of a lot of the neurotropic growth factors, a lot of that neuroplasticity where neurons are taking on new function is happening in those first few weeks and months. So it's super important to engage where you can. And then the last couple of things is focus on what you can do, not what you can't do. So shift away from your limitations, look at abilities, look at the next thing that you're going to target in terms of a new ability. Like I mentioned for the caregivers, don't hide your emotions. It's okay to be frustrated, sad, anxious. Talk to someone, talk to a family, talk to someone professional, a therapist, a support group, a peer support group. And then you might have down days, you might have low energy days, but you need to engage with the program, and that includes taking your medications. The rates of non-adherence with medications are very, very high among stroke survivors, and that can have devastating impacts. Even missing medications for 1 or 2 days can land you back in hospital with an even more serious stroke, and the outcomes are less good if you have a second stroke. And attend your follow-up appointments to learn more, to make sure that everything that can be done is being done, and to make sure you don't end up with any new problems like dementia, heart attacks, etc., etc. And finally, focus on the future. Decide what's important for you. Find your ikigai, as the Japanese say, your reason for living what's going to get you out of bed in the morning for the next few weeks, months, years. Focus on that and achieving that goal.
Yeah, that's brilliant. Yeah, no, open communication is, for caregivers and also stroke survivors, it's so important that they both have open communication with each other, celebrate the wins together, but also share the bad days and make sure that they know that inform their carers that they're having a bad day and they have that support. And like you said, just seek support from everywhere that you can possibly.
Yeah, it is available. So do seek it. Every little bit helps for sure. Yeah. Well, Dr. Marnane, you've given us some really great advice there, and our chat today has been extremely insightful. I know many stroke survivors, their families, and many others will find this information extremely helpful. So many thanks for your time today.
Thank you so much for the invite. It's a pleasure.
Many thanks.
Thank you.
This podcast was brought to you by StrokeLink. I'm Lauren McDunphy.
And I'm Melissa Gannon.
Make sure to follow our podcast series on Spotify, Apple Podcasts, or wherever you download your podcasts to learn about living well after a stroke.
If you like this podcast, please like and share it with family and friends. You can learn more on our dedicated website, strokelink.ie, where you will find an array of information and content written by stroke healthcare professionals, along with information on community supports and services. And always remember,
Stroke matters,
and you matter. See you next time.
StrokeLink podcast was brought to you through the support of the Mater Hospital.